Hi everyone, I'm Dr. Mohammed Sajjad, Assistant Professor in the Department of Emergency Medicine. Today we are going to discuss about the topic of triage. So triage originated from the French verb trier, which means to sort. It was first developed in the battlefield in the 18th century by the chief surgeon of Napoleon's Imperial Guard. So the first ever triaging that was done by him is that he set a clear rule for sorting out patients for treatment. That is, to treat those patients who were dangerously wounded first without regard to rank or distinction. And eventually this triaging has continued over several wars and battles and disaster situations, and eventually this triaging method has been taken up to a in-hospital setup where we use the triaging system to grade patients into different levels based upon the seriousness of their illness. So what is a triad system? So triad system, I said basically it means to sort patients. So what should be an effective triad system? Effective triad system should be able to classify patients into groups according to their equity of illness or injury. And not only that, it also should aim to ensure that the patients with life-threatening illnesses or injuries receive immediate intervention and the greatest resource allocation, with emphasis here being immediate intervention and greatest resource allocation. So it doesn't matter when the patient came in or the order by which the patients have presented to you. It matters what their acuity of illness or seriousness of injury is. So triages are of different types, and depending upon where the triaging system is implemented, different triaging modalities are available to us. To put it in a very simple way, we can classify triage into simple triage and multi-level triages. So simple triages are triages that are done in disaster situations or multi-casualty situations when the patient load is more than that that can be handled by the hospital or by emergency services. So some examples of simple triages will be mass triaging. So all these are mnemonic. Mass stands for move, assist, sort and send. That will be the simplest form of triaging. The other forms of simple triage are start triage, jumpstart triage, which we'll be looking into a bit of detail in the coming slides. Or simple triage can be something as simple as screening for diseases on presentation to the hospital. In the time of the COVID pandemic, all health centers and hospitals do a simple triage when the patient presents to the hospital. That is to look out for signs of COVID-19. That can be fever, upper respiratory tract symptoms like sore throat, cough. So even something as simple as screening for disease is a triage. Then you have the second classification, that is the multi-level triaging system. So these multi-level triaging systems are used mostly in a hospital setup where according to different guidelines or different factors, we can classify patients into one of many levels, starting from very severe to a level where patients can actually wait for some time to get care. So examples of multi-level triaging systems will be the oscillation triage scale, which is being used widely in Asian as well as Australia. The other examples will be Manchester Triad System, Canadian Triage and Equity Scale, Emergency Severity Index, and the Taiwan Triad System. So this slide also just emphasizes the fact that there are different types of triages available. As we discussed, you have in-hospital triages, you have mass casualty or disaster triages. There are even some triages that are in use in ICUs, ICUs where there is a high turnover of patients, to triage those patients who are admitted into the ICU, and telephonic triages also. Now, some considerations or some things that we have to keep in mind while approaching triaging or before triaging the patient is, one, as with any intervention by a healthcare professional, scene safety, personal safety is of utmost importance. So you should always make sure that the scene is safe for you as well as for the patient to whom the service is being provided. Second is personal protective equipment. It has always been important and never more so than now in light of our ongoing COVID pandemic. Whatever the resources available, the appropriate PPE should be donned by the healthcare providers. Clear and effective communication. The triaging point will be the first point of contact between a patient and a healthcare provider. So the presenting complaints or whatever is the problem that is being said by the patient has to be clearly recorded. It has to be effectively communicated what is going to be done, what is the plan that the patient or what the patient will have in the hospital has to be clearly communicated to the patient. Another important point to note here is a language barrier. Since we live in a multilingual society, language is often a barrier. If we get patients who do not speak a native language or who do not talk in any of the languages we know, we have to ensure that we get someone who can communicate with them effectively. The next point will be quick assessment and documentation. So triaging is in no way a complete primary assessment of a patient. It is a quick examination so we know who are the sick patients and we can see to it that the sick patients will get fastest and most effective treatment. So quick assessment is the emphasis point here, and as always documentation is also equally important. And last will be screening for infectious diseases. So always the patients have to be screened for infectious diseases before triaging can be begun.